Hi, I'm Professor Jane Fitzpatrick from the University of Melbourne. First, thanks to the American Journal of Sports Medicine for the publication of this research, which was led at the University of Western Australia by myself, a specialist sport and exercise physician, Professor Minghao Zheng, and in collaboration with orthopaedic surgeon Professor John O'Donnell, Professor Paul McCrory from Melbourne, and biostatistician Professor Max Bulsara from Notre Dame University in Western Australia. We know that tendinopathy of the gluteal tendons is a major cause of lateral hip pain and is the most prevalent of all lower limb tendinopathies, and that levels of dysfunction equal to severe osteoarthritis of the hip have been found in people with gluteal tendinopathy, particularly those who fail conservative treatment. Our study question was to determine whether there would be a difference in the modified Harris hip score between a single leukocyte-rich PRP injection compared to a corticosteroid injection. This was a double-blind randomized controlled trial undertaken between 2013 and 2016. 228 consecutive patients referred with chronic treatment-resistant gluteal tendinopathy were screened to enrol 80 participants. Subjects were randomised 1-to-1 to receive either a single cortisone or PRP injection under ultrasound guidance. Our results showed that subjects had a mean age of 60, an expected ratio of female to male of 9-to-1, and a mean length of symptoms of more than 14 months. Pain and function measured by the mean modified Harris hip score showed significant improvement at 12 weeks in the leukocyte-rich PRP group compared to the cortisone group. Importantly, we were able to show clinical recovery measured by the PASS score in the PRP group. This study design has enabled us to overcome the dilemma of having corticosteroid as a control. Even if we postulated that corticosteroid may have a poor long-term outcome, we have been able to demonstrate that PRP allows the patients to make a full functional recovery. Thus, the treatment with PRP is not only more effective than corticosteroid, it functionally resolves the tendinopathy. The significance of this is we now can use a single leukocyte-rich PRP injection and a home-based exercise program as a simple, effective treatment for chronic recalcitrant gluteal tendinopathy that allows a functional recovery and prevents the need for surgical intervention in the majority of these patients. The subjects in this trial have been followed in an open-labelled crossover extension to the trial out to 2 years to determine the long-term outcome. A further study is underway to assess the radiological changes on MRI and identify whether the clinical progress equates with radiological change on MRI.